Bruce, thank you. We are going to be able to answer many of those questions that you just mentioned. A lot of people are calling in and asking about the vaccine. We just found out today that the doses are in Indiana now. What should people know baseline about the vaccine?
Well, just to clarify, we do know that the inhaled flu vaccine, and Carrie is going to be talking about that in her pharmacy section a little bit more to describe the differences, but that is in Indiana right now, but a very small limited amount, and that's injected nasally. It's not a shot. We have very limited doses that we have not received any in Fort Wayne yet, and then we expect the injectable, the traditional flu shot that people normally expect, we expect those to start arriving next week or so, but we haven't had any confirmation of that yet. But I do think it's really important for people to realize that we will not get 350,000 doses to begin with, because they, very quickly started the manufacturing of this using the existing infrastructure. But because they started quickly manufacturing this, it's going to be coming out in weekly allotments. Because of that, because the CDC anticipated that we wouldn't have it available, what they decided was to convene a group of experts, the Advisory Committee on Immunization Practices, to determine who should get that vaccine first. And so they've established some priority groups on who will be the first to receive that vaccine. The first group will include pregnant women, people who live with or care for children who are less than 6 months of age, because babies less than 6 months can't receive the shot, healthcare and emergency medical services personnel that have direct patient contact, children 6 months through 4 years of age, and children 5 through 18 years of age that have conditions like asthma, diabetes, those kinds of things. As our vaccine supplies continue to increase, then we'll move on to include other folks, all kids under the age of 25. We'll have people from 25 through 64 that are at higher risk, again, those people with diabetes and lung disease, those sorts of things. And then we move to people 25 through 64, and then people over 65. So again, we anticipate that we'll be getting weekly allotments, and then to inform people about this, we'll have it on our website, fighttheflu.org.
Now, it is important to distinguish between the H1N1 vaccine and the vaccine that is for the general flu, the seasonal flu that will happen. Many people right now are getting those flu shots. Tell us what the difference is. Should you get both? Do you need both?
Very good point. Yes, a lot of people have their seasonal flu vaccine available. You'll see it in your doctor's offices and pharmacies. That's against seasonal flu vaccine. There is no protection against H1N1 in our seasonal flu vaccine. So we do want to encourage everyone to get the H1N1 vaccine as the supply increases and as everyone qualifies for that. Priority, though, are those people, again, in the at-risk groups. Those people need to, as soon as it is available, they need to make sure they get the H1N1 vaccine, and also seasonal flu. Remember, the seasonal flu vaccine, though, that we're getting now, that vaccine, that protects us against our traditional flu season that we have in January, February, and March.
But not against the H1N1.
Exactly.
That's the difference that we want to make sure that viewers know. Now, if I'm in a high priority group, where do I go to get the vaccine?
Well, we've had a great working relationship with our healthcare providers because they provide care for these people on a regular basis. So we'll be working with our private providers so that they'll be able to go to their doctor's office and get it. We're going to establish some on-site clinics for us to be able to provide the flu vaccine for, like, caregivers of infants, for children, those sorts of things. And we'll release those details as we have the vaccine availability made aware to us, and that'll be on fighttheflu.org.
And there will be a cost to those, I'm assuming?
Well, it depends on where you get it. There's no charge for the vaccine. The federal government purchased the vaccine, and the vaccine is free. There may be an administration charge depending on where you get it.
Okay, that's good information. We will talk to you again in just a little bit. Thank you very much, Dr. McMahon. We'll send things back over to Jim Blue now.
Thanks very much, Heather and Dr. McMahon. This has been fascinating. I've had a lot of my questions answered in the process here. We're going to have some more here right now, because Carrie Maffio joins me. She's assistant professor at Butler University, the College of Pharmacy and Health Sciences.
Yes.
And Carrie, you're going to talk a little bit about the vaccine that showed up just today in the state of Indiana. What's that?
That would be the nasal vaccine. That is the first round of the H1N1 vaccine that has become available, which is delivered actually into the nose. So the intranasal or nasal vaccine was delivered today.
Okay, and who gets that and who doesn't?
Okay, it's important to know that basically if you're between the ages of 2 and 49 and are healthy, so you do not have any chronic health conditions, and you're not pregnant. So if you're pregnant, you should not receive the nasal vaccine.
Okay, and those are important considerations. We're going to show a family here in this segment that we produced, that Daniel Woodruff did for us here at Fox Fort Wayne, that shows a family of primarily of young children and their concerns about the flu and about who should get vaccinated. So let's go to that videotape.
Meet the Allen family. Tracy and Amy have 6 kids and another on the way. With so many at home, illness can spread quickly, especially the flu.
Chances are if one gets it, they probably will all get it. So we try to keep it out of the house as best we can.
You hate to see your kids feel sick, so whether it be the H1N1 or the regular flu, I don't want either. So I'm going to do all I can to prevent both.
The Allen County Health Commissioner says an important part of preventing the H1N1 flu is the vaccine.
The children in general tend to have more complications with this influenza virus.
But vaccine supplies could be limited. So who's at the front of the line? Well, for one, little Pete, who just turned 1 year old, as well as all other kids ages 6 months to 4 years. Also in front, pregnant women like Amy and caregivers of infants. The Allen's baby is due in just 9 weeks.
I plan on getting it as soon as we can.
But for most of the Allen kids, one shot likely won't be enough. Health officials say children under 10 will probably need 2 doses, separated by about 30 days. That's because their immune systems are still developing.
We will be going to get shots quite often.
Tracy and Amy are following this closely. They want to keep their family healthy and happy, and they know much of that responsibility rests with them.
Especially the young kids, when they can't tell you what's wrong. You know, they can't tell you what their symptoms are or what makes them feel good. So you try to do everything you can to prevent the illness.
More information about the H1N1 vaccine is available online. Just head to cdc.gov. Reporting for H1N1 Community on Alert, I'm Daniel Woodruff, Fox Fort Wayne News.